We had 1.5 days of wonderful scientific sharing, and we discussed treatments, modalities in pregnant cancer patients. We discussed surgical treatment of those patients. We discussed the follow-up of the babies whose mother had been treated with chemotherapy during pregnancy, and those are new data. And the last day we also had a kind of insight into the psychological issues that those patients have to face. This meeting is the first meeting regarding cancer and pregnancy which was endorsed by ESGO. ESGO is the European Society of Gynecology Oncology. And ESGO did this survey, and they asked physicians, gynecologists, medical oncologists, radiation therapists, what would they do if they had seen a patient with pregnancy-associated cancer. And as you said, it was quite disappointing that many of these physicians would just interrupt the pregnancy, and because of the fear that chemotherapy could be harmful for the fetus. Even if this is true for the first trimester, it is now well known that it is not true when the patient is treated beyond the first trimester and starting from the second trimester. So this is really a need for more information among doctors, and ESGO, and we just decided with in the ESGO task force of cancer in pregnancy to set up a number of, let's say, informational meetings in which we tell doctors what is in the literature, what is appropriate as treatment for these pregnant cancer patients. And I think that this would be important because even if pregnancy and cancer, I mean, is not a very frequent situation, it's a situation that is going to increase because of the, let's say, increased age at delivery and because of the increased incidence of cancer during reproductive age. Again, there were very interesting data that were presented. Some data that were generated in animal models, some data from human samples, some data for mice models. And those data clearly state that placenta works as a filter, as an active filter. So all drugs which are somehow targets of the P-glycoprotein, of the MRP, the ABC pumps, actually, have a very high gradient between the mother and the fetus, which means that just a small part of what you get to the mother, you give to the mother, get to the fetus. And that's very important because for some drugs, the passage is really very limited. Less than 5% of the drug gets to the fetus. And this is very good news also in terms of counseling, because if the mother knows that what she receives is not a transfer to her fetus, well, or her baby, that's very important. And this is true for anthracycline. It's true for taxanes. For cyclophosphamide, it's around 20 to 25% transplacental passage. And for other drugs, the passage is more important in terms of percentage, for example, for the platinum derivatives. Next meeting, well, in a couple of years, and we will probably do it either in Germany or in Belgium or in Serbia.